Welcome back to Healthy Living, brought to you by St. Tammany Health System. We're talking today about a community advisory council focused on a healthier Louisiana in Washington and St. Tammany parishes. We spoke with Ann Pavlovich about the council and how we are coalescing health, civic, and government organizations together to focus on health and wellness. We spoke with Dr. Michael Hill about the population health component. And last, we're going to take a look at the mental health component, talking with Richard of NAMI St. Tammany. Nick, thanks so much for joining us.
Thanks for having me.
Really excited to have you here for a number of reasons. One, it's just nice to be around humans we're crawling out of our isolation and COVID.
As social creatures, we do need other human beings, yes.
We do. It's good for our mental health, as a matter of fact. And as this Community Advisory Council is looking at population health and looking at how to move Louisiana up that ranking of healthy populations, there's a lot of talk about chronic disease, about heart disease, diabetes. We're talking about COVID. Those are all aspects of our physical makeup, cancer, early detection. All of those things are looking at our heart, our lungs, our bodies, our organs. But aside from the organ, the brain, the mind, that magic that is the difference between the science and the emotion, that's a huge piece of our health. And so can you talk a little bit about how mental health is such an important component of this advisory council?
Well, you can't really have proper physical health without proper mental health, right? You know, it just as, if you're not doing well psychologically, you're less likely to live a healthy lifestyle. So you can't ask an individual with, for example, if an individual has major depressive disorder, they're more than likely not going to be doing the exercise, the dieting, all the other things, going to their doctor that they would need to do if it's untreated. If it's treated, then individuals tend to live a little healthier. But look at this as well. Depression is the leading disability worldwide.
Wow.
I mean, that is a statistic that is not often put out there. And again, that's from the World Health Organization. Mental illness, untreated mental illness, it costs the United States alone billions of dollars, not only from individuals, from going through the mental health system, the medical system, the jails, but also from their caregivers, right? Missing work, dealing with crises. Our statistic in our field is 1 in 5. So 1 in 5 individuals in their lifetime will develop a mental health condition. But when you factor in that those individuals not only have, husbands and wives and children, you really look at this it's a full community impact. It's 5 in 5. 5 in 5 people will be impacted by mental illness in our community. It's, so yes, I think of all of the healthcare agencies or industries, we've probably been the furthest behind. It's a little harder to distinguish. You can't just take a blood test and say, hey, well, this person has this. But with proper treatment and access to services, the good thing is you can live successfully with the mental illness. So it is the type of chronic illness where you can have a pretty successful life.
Absolutely. And I think you're getting at an interesting connection between our physical health and our mental health. When we were talking with Dr. Hill about our population and what some of our worst chronic conditions are, when you look at heart disease and you look at diabetes and you look at obesity, there are many times mental health roots to those or components to their being perpetuated.
Right. Well, you also got to look at it. If you get diagnosed with cancer, you're not going to be having a great day, right? And there's more and more research that's shown, and I was talking to Dr. Hill about this, there's more and more research that's showing that not only, obviously, your mental health is impacted when you have these diagnoses, but when you're in treatment, if you're taking care of your mental health, your outcomes are going to be better. Every chronic disease, if we're able to take care of our mental health, we're noticing that people are getting better faster. So it's directly tied to, the brain is one of the most essential organs in our body. It's just that we don't have, certain tests. It's just not as easy to distinguish between it. But I also want to put out there, the issue in mental health, again, it's not always access to treatment. We have that issue, just like, it was spoken about earlier. But when you look at the statistics, less than 40% of Louisianians who have a mental illness receive treatment in the year before they were surveyed. So we have less than 40% of people with mental illness receiving treatment. And then we start looking into the why, right? Is it access? Sometimes. In St. Tammany, we have adequate practitioners. We could maybe use some other services. But quite often, it's stigma and it's the understanding of what we're looking at and where do we go.
Well, tell me what you mean by that. So what we're looking at and where we go.
Sure. So, again, if somebody's exhibiting signs and symptoms of mental illness, not everybody's fully educated to know that that's what it is, right? Sometimes those signs, those symptoms, let's use children for example, right? So given that we've had all these restrictions with COVID, we've restricted our youth's access to their peers, especially in teenagers, we're noticing, and we're going to notice this for some time, we're noticing that you're going to see more behavioral issues, right? Yeah. Sometimes people are going to attribute that to a kid just being a bad kid, right? It's not always that. It's the same thing with an individual. Maybe someone's dealing with chronic depression, and you're saying, well, they won't exercise, they won't eat right, they're lazy. It has nothing to do with it. It has to do with their brain and the chemicals that are being produced and the help that they need. So, that's what I'm referencing. Sorry.
Okay. Well, that makes so much sense. I think, we as a culture have a tendency to say, oh, suck it up and get over yourself and get out there and just get on. And I think that's, we don't say that to someone who has a cancer diagnosis. Right. We don't say that to someone who has a heart attack. We need to recognize that a mental health crisis is also a disease, and it is a condition that someone needs support and medical intervention, although that's usually a combination, of course, psychology and psychiatry.
Right. Well, I think it's just like any other chronic disease. If an individual, and again, I'm not a doctor, but if an individual gets a you go into your doc and you have high blood pressure, right? Typically, I would imagine that you're going to try and deal with that by way of diet and exercise. And if that doesn't work, then eventually there's other interventions that lead to medication. Mental health is no different. Just because you have a mental health condition doesn't necessarily mean you have to take medication, doesn't necessarily mean you have to have therapy. Like any chronic condition, you may need a combination of those things, but also like any chronic condition, the earlier you intervene, the better your outcomes will be. So the statistics tell us what we know about mental health is by the age of 14, 50% of people who have a lifetime mental illness are showing signs and symptoms, and by the age of 24, 75% are showing signs and symptoms. The problem is the average time between the onset of mental illness and the actual treatment is 11 years on average. There's no other chronic disease that exists where you will have an 11-year gap between showing signs and symptoms and actually receiving treatment. So I don't mean to oversimplify it, but in the mental health world, the answers are actually quite simple. We just need to get people in the door sooner, and I think that's the case with most chronic health. And again, we've used many different strategies in the mental health world. It has to do obviously with education. Education is one of the biggest things that we can do as a community and as a society, is educating people not only to the signs and symptoms, but also that it's okay not to be okay. It's all right. We can get you help. We can get you where you need to be. It's not something you need to be embarrassed about. It's not something you need to be shameful of. And when we can remove that stigma and that shame, we can help people live in a healthier community.
Absolutely. And so I think this fits so beautifully into that Community Advisory Council and its aims of education, early detection, and connection with resources, because our mental health is just like our physical health. If we can educate the public, if we can detect it early, and then connect people with the resources that they need, then we wind up with a healthier population overall.
Yeah, it's funny because I'm so focused on mental health, and I didn't really think about applying those same principles until I've gotten engaged in this and really just looking at the principles. They can be applied just as easily to all of our primary healthcare issues. So I'm happy to be a part of this, and hopefully we can bring the experiences that we've learned in decreasing stigma and educating people in the community with mental illness.
Outstanding. I think that the mental health industry has something to teach those of us in the physical health industry, especially because so much of the work that you do is outreach in the community. And we as a community health system and our partner Ochsner Health and as a not-for-profit for Louisiana and Mississippi Health and Wellness, I think we're all focused on how to create this healthy population for everyone to improve their quality of life and their overall health and wellness, and that has to do with the connection between mind and body.
Well, it's all connected. Again, if I don't feel that I have value, I'm not going to take care of myself, right? If I don't feel that I can get outside of my own head or even outside of my own house, or if I don't feel a connection to my community because I've been ostracized or because I'm dealing with untreated mental illness, I'm not going to put the time into taking care of myself because I don't feel like I have that value. So again, when we're dealing with especially depression, giving their brain, individuals with depression, quite often their brain's telling them that they don't have this value, that they're not worth that. And when we can get people into treatment and get them the help and the support that they need, which is relatively inexpensive in the grand scheme of chronic illnesses, then they're going to end up taking care of themselves as well, and they're going to be healthier people all the way around.
Brilliant. Well, Nick, I so much appreciate you coming in today to talk about the mental health component of overall health for our population.
I thank you for having me. I mean, this has been, as a mental health advocate, it is energizing to see our community come together and talk about a topic that for so long we haven't talked about. We haven't really even recognized that it was so much of an issue. So for all these leaders, in our healthcare community to come together and to even put a spotlight on mental health and its connection to the communities, it inspires me.
Well, thank you. You've been watching Heathy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson. We talked today about a community advisory council focused on a healthier North Shore. We hope you'll join us next month for another episode of Heathy Living.